Welcome to this evening's Facebook Live session. My name's Natasha. I'm one of the clinical nurse specialist nurses here at Breast Cancer Now, and tonight I'm going to be joined by Naman, who is a therapeutic radiographer and also the co-founder of Rad Chat. So when he joins us in a moment, I'll let him introduce himself and explain a little bit more about that. But just a little bit of housekeeping to start with. So the topic tonight is part of a series of Facebook Lives and webinars for MCAM, which is Ethnic Minority Cancer Awareness Month, which is throughout the month of July. We're going to be talking about how treatment side effects, specifically radiotherapy tonight, can present differently on different skin tones, and the importance of representing this in our information and also in discussions with patients. We will be answering any questions that you have on this topic, so please do post any questions in the comments. We will answer as many as we can live this evening. We have about 30 to 45 minutes, so anything that we don't get around to answering this evening, we will try and answer in the coming days within the comments. Just a reminder that this is a live session and it's not a confidential space, so if you have questions that are a more sensitive nature, you might prefer to give us a call on our helpline. The number for that is 0808 800 6000, or you can write to us via our Ask Our Nurses service and send us an email on nurse@breastcancernow.org. We will link a survey in the comments at the end of the session. It's really helpful if you're able to take the time to complete. All feedback is welcome, and it helps us to know how to make these sessions better for you. And you can also send through any topic requests for future sessions, and it will help us to tailor these sessions for you. So that's all the housekeeping done. So without further ado, I will welcome Naman to the screen.
Hello. Thanks for having me.
Hi, Naman. Welcome. Thanks for joining us this evening. Many people that are watching may recognise you from other Facebook Lives that you've done with us and other projects that you're involved with. But for anyone who doesn't know you, are you able to tell us a bit about yourself and your background, please?
Sure. Thank you for the opportunity to be here. So my name is Naman. My pronouns are he, him. I am a therapeutic radiographer currently working in research in London. And I also work for Macmillan Cancer Support as an allied health professional clinical advisor. And you might recognise half of my face on our logo for Rad Chat with my colleague Joe, who we do a podcast which is listened to in 130 countries now. We do some education pieces around that too. So yeah, I like to keep busy.
And an award-winning podcast, so I hear.
Yeah, we've been very lucky. Won one international award and 2 national awards here in the UK.
Lovely, well done. So I do have a few questions prepared, and then we can move on to any questions that might have come through from people that are watching. So just to start with, many people do experience skin reactions when they have breast radiotherapy. Are you able to explain a bit about what might cause this and how it could be different on different skin tones?
Of course, so radiotherapy is a common treatment modality which uses radiation, so high energy rays that come from a machine and then they go into the target area where we want to treat, so within the breast or sometimes the chest wall if someone's had a mastectomy. The radiation itself doesn't discriminate with what it's kind of going through, so if there's any normal cells they can become damaged. So what this means is that when the healthy cells are damaged they can cause inflammation and things like that all around, and the clinical term underneath the skin is called erythema, which does mean redness and increase of blood flow underneath, but so that's the physiological side, but on the surface it looks very different on different skin tones. So for example, for someone with black skin it might look like it's more darker than the surrounding. Sometimes you can get grey, yellow or purple pigment changes, but also it's really important to touch the skin, so it could be warmer, tighter, things like that in the area. So someone like me, so with brown skin, I don't always go red. Some parts of my body go red, but mainly they go maroon, or it looks darker than the surrounding, but again, it's that touch. So commonly it's in white people or lighter skin tones, it's normally pink, red, sometimes even purple kind of tinge. But the main thing is that once those healthy cells are damaged, they have the ability to go back to normal, whereas any cancer cells are kind of cleaned out and killed off. That's kind of what we do.
Okay, thank you, that's really helpful. So if somebody was worried about any reaction they might be having on their skin after radiotherapy, what would you recommend that they do?
So skin reactions are very common for breast radiotherapy or radiotherapy in general. So the statistic is around 95% of all people who have radiotherapy will have some sort of short-term skin change. So that can be different. So for breast, head and neck cancers, some gynecological or pelvic cancers, they can have slightly more progressive or more advanced kind of reactions. And what that means is sometimes it can be from the first appointment, or it could be towards the end of the week, or the first week, sorry, or sometimes even where we call it the peak of the reaction could be about 10 to 14 days post-treatment. So it's important to know that the changes can occur sometimes from a few hours after your treatment right up till sometimes even 6 weeks post-treatment. Sometimes people can still feel some of the effects in the area. And it's quite normal, especially if people have had surgery or sometimes even chemotherapy. We can expect that reaction to continue. But during the treatment, it's obviously we're as therapeutic radiographers or your clinical nurse specialists, if they see you, or your clinicians, we're there to help you. So if you are worried about anything, it's not a silly question or a silly problem. We're happy to either take a look, do a physical examination, or guide you as best possible. We normally say, if you can, before the radiotherapy started, to try and get your skin ready. So almost like something called prehab or prehabilitation. So if you're using a moisturizer that you normally use every day, as long as it doesn't have any metals in, or any kind of perfumes and things like that, it's completely normal and completely okay to use those throughout your treatment. And we'd normally say at least twice a day, sometimes 3 times a day people can do. So for example, if you shower or wash in the morning, maybe once you've had your shower and pat dried, then you can put the cream on, let it soak in, and then sometimes before you go to bed in the evening. But it's really important to do that because it helps promote the protection barrier, keeps your skin hydrated, and yeah, it just helps as you go through the treatment. And sometimes it can delay a bit of the reaction. I think when it comes to your skin either feeling more sore or the color is changing, firstly, we should be able to see that ourselves as professionals, but obviously you're with your body, or the patients, etc., with their body 24/7. So any small change, you can always write it down and then let your team know them the next day. Some places are quite happy for you to take photos and we can upload them with your hospital record so we can monitor that change. But if the reaction gets to the point of being painful or really almost like a nerve ending pain, sometimes you get shooting pains in the area if you've had kind of surgery close to where the radiation is being delivered. It's completely normal, and normally we find that post-treatment things start to settle quite quickly. Yeah, try not to overload people with too much information.
So a key point is kind of moisturise as frequently as possible. But we quite often get people asking us on the helpline about any particular products that they might use. Do you have any specific recommendations, or is it more just as long as they're moisturising, that's the most important thing?
So the thing we look for around evidence for any creams or topical agents is if it's been found safe to use in people who are going through cancer treatments. And there isn't really a consensus anywhere in the world to one product being better than the other. It's more about the ingredients that's in them. So no metals, no perfume. Sometimes if ointments or creams have aloe vera in, that's great, but make sure it's 99% aloe vera. And actually, if you're using an aloe vera based gel, it's actually really good also maybe 10-15 minutes later to also use a cream, because the aloe vera gel can dry the skin out, and we don't want your skin to be dry because then that can lead to sometimes cracking or peeling of the area when you're having radiation. It's really difficult because you want to be able to guide people on different products and especially price ranges, etc. Just be careful with what's out there. There are a lot of products that are marketed all across the world as really good for radiotherapy or radiation, but actually they have metallic elements in them or things like that. So just speak to your radiotherapy team, either your oncologist, clinical nurse specialist, or your therapeutic radiographers. We're the ones who can advise you. Some departments in the UK might give you a cream. And what I would say is that for different skin tones, which I think we might come on to anyway, but some creams like E45, they can dry. So they dry my skin out as a brown person, I think, just because of the level of oil that's already in my skin. So I don't use E45 and things like that, but it's just to have a conversation with the team. I think they'll be able to guide you a bit better.
Okay, yeah, great. Actually, my next question was going to be: is there any different skincare advice for different skin types, or is it the same? And you've kind of given a bit of an answer, but is there anything else that you might need to think of to do differently if you have different coloured skin tone?
Yeah, I think it's also good to know about your cultural heritage, and obviously this is the sort of month to be talking about it. So I was born and raised in India. We always use coconut oil or shea butter based things, and that's what really works well for me, or yeah, anything kind of coconut based. So it really helps to moisturize my skin. Obviously there's different products and stuff you can use and try, but I think there isn't enough guidance or evidence out there because it hasn't been considered. That's again why we need this sort of month talking about ethnic minorities and the lack of evidence and things like that. But in where I'm from in India, everything is coconut oil based or coconut based. It really helps with all of us. I think knowing your background, what you're used to, as I said, to make sure there's no metals in it, no perfumes and things like that. That's kind of one way to look at it. I think apart from that, obviously it's quite nice and warm today. I don't know about you, Natasha, but I'm sweating right now. Put the fan in the living room for my wife. But that's also really important when you're having radiotherapy, because we don't want clothes to be sticking to your skin, because what it does is as the moisture builds up with sweat and obviously with the clothing fibers, it can start to cause friction, and that can sometimes make the reaction a bit quicker to getting to sort of blistering or almost like skin breakdown. Try and keep yourself aired out as much as possible. I know it's not always easy to walk around topless or without a bra or things like that, but it is really important to keep those areas quite cool. And I think if you are someone who has a larger chest than other people, underneath the breast where there's a bit of a fold, trying to keep that as dry as possible, because we know from radiation, just the way the radiation doses work, but also the friction, as I talked about, that can sometimes be one of the first areas that gets more of a kind of a worse or more intense skin reaction. So that's really important. I think if you've had chemotherapy before, it's also really important to look after your skin, because sometimes the skin can be a little bit more sensitive or dry following any kind of chemotherapy. So again, that's where the prehabilitation of skincare, cream, etc. is really, really important. But boring advice, and actually this is for anyone, any background, is make sure you drink lots of water. Cells are made up of 70-80% water. And actually, the more hydrated you are, you'll learn as well, your skin feels a lot nicer, and things like that. I think that's the most generic advice I can give. But I think
so hydrate on the inside, but also be a little bit cautious about the type of skincare that you're using. It might be different for different types of skin tones. And also check the ingredients, is what you're saying, and check with your team.
Yeah. One thing I will say very quickly, is around anything that has sun protection factors, so SPF, in it. So obviously we should be using sun cream all the time, but anything within the treatment area, while you're having radiotherapy, don't put anything with SPF or sun cream at all in the area, because they do have some metallic elements in. They might say it's for sensitive skin and stuff, but it's actually not what you want. And it's a different kind of radiation, I guess, to sun radiation. So we're not trying to use the SPF to protect against the radiation from radiotherapy, because we want the radiotherapy to get inside to where we want it to go. So if you can avoid it for at least 2 or 3 weeks post-treatment in the area, try and keep it as covered as best possible. And it's just something to be aware, especially for someone who's having, say, one side of the chest or the breast area, that is always going to be more susceptible to sun damage in the future. So if you're ever outside with a low-cut top, or if you've gone holiday, whatever it is, you'll notice that side will become more tanned to the other side that hasn't been treated, and it'll be a lot quicker. It's just something to be aware of from a late effect perspective. I think some patients I've seen in clinic, they really struggled with that body image, because it's highlighting, well, something has happened to that area. Why is there a rectangle where I've been treated? But it's just something to be mindful of in the future.
Okay, that's really helpful advice and information, especially given the hot weather that we're having at the moment as well, about sun cream. So you mentioned earlier about skin reactions can look different depending on the skin tone that you have. So you have an image library on your Rad Chat website. You're able to tell us a little bit more about that? It sounds like a really helpful tool.
Yeah, thank you for the opportunity to talk about it. So Rad Chat, obviously, podcast and education platform. We developed a website earlier this year, and we decided that, again, around equity for people of colour, but also anyone really who has a skin change or skin reaction from oncology treatments or radiotherapy, we set up a continual professional development, so CPD accredited, safe, medical, legal, everything. We've been through all the due process and governance, so that if you go on our website, www.radchat.co.uk, we've got lots of images of breast cancer, head and neck cancer, all these different ones of different skin shades, so brown, black, also some white and lighter skin tones, just to show what it looks like. And it's not to scare people. I think obviously as professionals we want to protect everyone, but realistically these are some of the reactions that could occur. But I think, as we've alluded to, is the colour changes can be very different across different skin types. And again, medical education, imagery is not very diverse. Some medical databases and libraries at the moment, they only have less than 2 or 3% of people of colour in them, with their hundreds of thousands of images. And also, I think you can't do any sort of conference talk or anything like this without talking about AI, but AI is also quite biased. It depends on who's developed it and who's put the baseline images in first and what it's trained on. And about 90% of the time at the moment, they're always based on white skin. So even some of the more prominent ones, like the Google ones, if you take a photo, so my skin tone or someone with black skin tone, it normally lightens the image as well. So it's still not giving a true representation of what it should be. This is kind of where we've come in, that we're not trying to make money from it. We just want to help educate people, earlier diagnosis, earlier sort of getting in with prevention, hopefully, so people know what to look out for, but also professionals. There are areas, in the UK and across the world where potentially you might not see as many people with brown skin or black skin tones, but that doesn't mean we shouldn't all be prepared as healthcare professionals. That's kind of Joe and I's ethos behind it. We've also got something that we're quite proud of, is sort of anatomical images. So if you look at skin anatomy or something like that on Google, it's 99% of the time is someone with white skin tone, but actually we've started to work with a really good illustration artist called Graphic Design, a friend of mine, who has done some with different skin shades. So for education or anything like that, you can see what it looks like. And I think it's that representation that's really important, that if I don't see someone like me in an advert or in a booklet or something, I'm probably less likely to think that's for me. That's kind of where we've come from. So yeah, thanks for letting us talk about it.
Yeah, and I think it's really important as well, and quite any calls that we get through to our helpline about people that have got kind of post-radiotherapy reactions, most of the time it's just wanting to know whether what they've got is normal. So I think having something like the image library that can help people kind of see whether what's happening is normal or not, and also help to kind of guide them whether they should be kind of seeking any extra advice and support from their teams. I think it sounds like a really valuable piece of work that you've been doing. And then what you were mentioning just now about kind of graphics and different skin tones, that kind of leads us quite nicely onto mentioning our at Breast Cancer Now, we have what we call our TLC messaging, which stands for Touch, Look, Check. So it's about breast awareness. So as well as skin reactions from radiotherapy looking different on different skin tones, signs and symptoms of breast cancer can look different on different skin tones also. So we have some graphics that for our breast awareness campaign that have been made in different skin tones to help highlight the fact that this can look different for different people. So in much the same way you said, as you were saying earlier, so something that might look kind of red or kind of like a rash on white skin may make the skin look darker, or kind of different shades of kind of greys or purples, or various different things could happen that will just look different. And as our advice is always to anybody who is checking their breast or chest area, it's really important to get any changes that you notice checked out by your GP, so that they can kind of either hopefully reassure you, or if not, they can refer you on to a breast clinic where you can get the kind of get checked properly, just to kind of make sure that everything's okay, or if not, then you end up getting the treatment that you need. So I think it's really important to kind of highlight these differences as well. And then, Naman, so we know that you're, as you've just kind of been talking, you're a very passionate advocate for diversity being represented in cancer care. In your experience in practice, have you noticed any improvements in this? What would you say is the kind of current state of play?
Big question. I think it is improving. I'm obviously going to be quite biased as a person of colour and immigrant, that there's still a lot more work to do. But I think it's always on the tip of everyone's tongue to be doing better. But there's a few different angles to it. One is that people are a bit nervous or scared to talk about how to improve, and obviously that's looking at their own biases and language, being more inclusive, etc. Then there's the cultural competency side of things for healthcare professionals as well. But again, if the education that we're all trained on isn't inclusive and diverse, it's going to be quite difficult. And then it's also thinking about the future. So AI, imagery, TikTok, all these different things where there's fake news and all that. Like, how do we manage all of that for all the different types of backgrounds of people, either in English or in different languages? But I think as we come forward with kind of the NHS plan and everything, it is starting to improve. Obviously, I'm trying to be as diplomatic as possible, but there's so much more to do. And I think it's a collective effort. And obviously, like you talked about, the tool that Breast Cancer Now developed, these sort of little changes, although it might seem like it's a small thing now, in 5-10 years time, that's going to have helped so many millions of people just to think about it. And even if it's, actually, no, I know that, this person that I work with, they have a different skin type to what was, is my skin type. Maybe I'll guide them towards this. And it's just about educating and empowering, I guess, and then hopefully helping in the future. I think the screening uptake is something that's quite important, and it is about going into the right communities. So, for example, South Asian women are less likely to go for their screening appointments, and it's usually the same sort of comment whenever I speak to those kind of South Asian groups, is that, well, actually, we've never really considered that breast cancer affects Asian people. It's always been portrayed as a white woman, middle class background kind of cancer, but that isn't the case. There are more people who are being diagnosed with breast cancer, but also in the Black community, they are usually, unfortunately, diagnosed at a more advanced stage, and it comes down to symptom awareness. So this education around what it looks like, what it feels like, talking to each other, that's really where it comes through. So yeah, it's improving, a lot more work to do, but I think having a month like this and this sort of platform for someone like me to be able to represent, people from my background and other backgrounds, that's kind of what it's about. It's nice to have this conversation and move forward with it.
Absolutely, yeah, and completely agree with you. Any progress is obviously positive, but there's definitely a long way to go before we're where we should be. I'm just gonna. So a couple of questions did come through before this evening, so I'm just gonna ask those first, and then there's a few that have come through on the chat. Somebody was asking a question about Mepitel film and availability on the NHS. They're saying that they used it, they provided their own in private, and whether this is something that we can get on the NHS.
You should be able to. So wound care, although we like to obviously be standardised across the UK, it would depend on availability and what that department stocks. And that's just being honest. I've worked in quite a few different departments, and the preferences over what they do like to use might be slightly different, but it's a good brand. The only thing with the film, I think it can be quite sticky. So there may be some hesitancy if you've had a skin reaction to not try and peel away any of the skin cells that are around. But apart from that, I don't see why it wouldn't be on the NHS. I've definitely seen it and used it.
Hopefully that helps the questioner. And so somebody else that came through beforehand was asking about the length of skin rashes and reactions from radiotherapy. Can you get them up to 4 months afterwards?
Yeah, you can do. So obviously, I said what I was trained on was 10 to 14 days post-treatment is when it should be the worst, and then it should start to get better. But so late effects, whether it's for skin or for anything, we normally say is between 3 to 6 months post-treatment starting. If it's been persistent and going on, then we know it's probably a late effect. But skin changes are, I suppose, interesting in the respect that depending on if you've had chemotherapy or any other kind of skin changes from that as well, they can keep kind of appearing in different ways, either like small patches or, in the area in some respects, sometimes up to 6 months afterwards. And I think, especially if people have had sort of the sentinel node biopsy, any kind of scarring in the area, sometimes those feeling kind of effects, they can take a lot longer. I'm sure, Natasha, I think if you've been on the phone line, that's probably something that you hear as well, is actually the area is still numb even after radiotherapy, and you get shooting pains or the skin looks slightly different. I think the main thing is that it shouldn't really last too much longer, hopefully. But if it is, get in touch with your radiotherapy review team if they have one, because there are a lot more centres that have late effect services, and they might be able to have a look and sometimes involve dermatology just to make sure there's nothing else going on.
Yeah, that's a good idea. I think if it's been going on longer than expected, then get someone to have a look at it. We do get a lot of people mentioning that you mentioned earlier, the kind of rectangle, that kind of people that weren't kind of warned that could be something that happened and that could be there for some time after the radiotherapy is finished. So yeah, we definitely get questions about that. There's some questions that have come through this evening. So there's a question from Louise asking again about Mepitel film that's available in the US but can't find any information. So I think you probably answered that one earlier, that it might be available in some places.
Yeah, I think, again, just make sure the local department, if you are going for treatment, just have a conversation with them. Because, again, depending on the oncologist, the type of treatment we're having, the type of treatment you're having, and any of the other factors, they may not want to use that, or they might have an alternative, something like that. There is a lot of evidence around topical steroids and stuff, and they can sometimes be used in conjunction with a film like this. I think that's why I'm trying to direct you to the healthcare professionals, because if there's a proper plan in place, at least hopefully you'll feel a bit more reassured that they are doing everything they can to help you. But it also might be that it isn't appropriate for your skin tone, so it's not that they're trying to fob you off. or not trying to protect your skin. It's obviously, hopefully their expertise is coming through to help look after you.
Yeah, it's definitely always a good idea to speak to your own healthcare professional, because things are done slightly differently in different centres, and different clinicians are going to have different reasons for preference over certain products. So it's always a good idea to chat anything through. So we have a question from Lois about vitamin E cream, if that can be used after radiotherapy.
Yeah, it should be fine. I mean, it's a topical agent, as I said, as long as within the 2-3 weeks post-treatment, there isn't anything perfumed or metallic in it, vitamin E cream is completely fine. There isn't enough evidence to suggest that it's going to make a huge difference for kind of radiotherapy side effects, but because the radiotherapy side effects for skin, we know they don't really cause scarring. I think anything will really help afterwards. One thing I forgot to say with the heat is you can put a lot of these creams in the fridge, and patients love that. And I think even I would love that, is being able to take it out, put it on the skin, and it really cools. And anything that's inflamed in the skin, it will just help calm it and cool it down. So I would say the same thing for that cream too.
That's a really great tip, actually. Thanks for that one. Something just come into my mind, actually. So you've mentioned about no metallics a few times, metallic things in the creams. What's the reasons for that?
So when it's on the surface, because it's metallic, sometimes it can exacerbate or speed up the process of that skin reaction. And so especially if someone has a wound, or if it's close to what we call, the word is desquamation, so where the top layer of the skin is starting to kind of fluff off a bit, and then you're starting to see maybe some of the dead scales kind of flaking off, and it looks a bit like Parmesan cheese. That's the best way to describe it. And any of the new skin cells coming through, any of those metallic elements, sometimes they can get stuck in the areas where the skin is healing, or it's kind of going through the cell cycle to become new and look after the area. And then obviously with sweat and things like that, then the next day, sometimes the radiation, it can get worse and worse. So we don't want to do that.
So it could make it worse. Okay, so that's a very good reason to avoid it then. So we have a question from Sarah. She's saying, thank you for doing this live. Sarah had a lumpectomy, then radiotherapy, didn't have any side effects until about a month afterwards, and had some radiodermatitis, was given steroid cream, which made it worse, and is now left with a dark skin patch and a hematoma, which is a harder lump, and asking if that's normal.
Yep. So lumpectomy is breast conserving surgery, for anyone that doesn't know. And then radiotherapy, as I said, the rule of thumb has always been 10 to 14 days post-treatment, but it can be delayed for some people. Radiodermatitis is another term for skin change. It's also sometimes called radiation-induced skin reaction. We love these big words, but it all means the same thing. Completely normal for it to happen at that time point. And the darker patch, that's almost like a tan. So for any skin tone post-radiotherapy, you'll notice that it will have that different color pigment change, and then it will look like a tan, like you've just had that area in the sun. Sometimes it varies. It can take maybe 2-3 weeks for some people to get it, like for that area to go back to its normal kind of skin tone, what it was before. Sometimes it can be a bit longer, but it's completely normal for that to happen. The hematoma, we know, obviously we would have known before your radiotherapy, and we'd be able to watch it and see it every day when we're doing the treatment and when we haven't done any scans. Completely normal for it to go harder. You might find that it starts to loosen up a bit and then also go harder again. So as the area is healing and improving, etc., any of the fluids, so like lymph fluid or anything else inside it, will move around, sometimes go back to it, sometimes move out again. It's completely normal. I don't know if you'd add anything about hematomas, Natasha.
I mean, just as you were talking then, I was thinking that just the breast tissue itself in general can become more firm. So if you've got a hematoma there in the first place, then I guess like it kind of goes without saying that could also become harder. And again, another reason why kind of continued moisturising and kind of massaging of the area is a really good idea.
Yeah.
So Pauline is asking about whether the side effects can stay with you forever.
Big question. I would say in some respect it can do. So obviously I have never had cancer treatment, but when we consent our patients, we give you a very long list of side effects that can happen in the short term or the long term. Any of the late side effects, as I explained, from 3 to 6 months post, they can occur either 3 months or 6 months post-treatment, or sometimes 20, 40 years down the line. And it affects people in different ways. So if it's the skin changes, as I said, they should normally clear up quite quickly. Sometimes within 6 months and things like that. But other things like fatigue, so tiredness, they can continue for a long time, and it will vary. Obviously, it depends on, is it warm outside? how's your mental health at the moment, things like that. And some of these side effects could be with you forever, but they may get better or they may get more tolerable, is I think what some people say, that actually you learn to tolerate sometimes the tiredness in the evenings and things like that, or the sleep changes, or sometimes hot flushes from hormone therapy, things like that. So they can do, but not all of them, is what I would say.
And as we always recommend on the helpline to people that are struggling with side effects, if you are having these ongoing kind of longer term side effects, if they're kind of causing you issues in your day-to-day life and you're struggling with them particularly, then it's always a good idea to if you're still under a breast care team, speak to your breast care nurse, or you can go to a GP. There may be things that they can do to help you kind of ease some of these symptoms, or if they're kind of really severe symptoms, it may be that you need referring to a specialist team, such as a dermatologist for skin reactions, or it could be a kind of a menopause specialist for any kind of endocrine therapy related side effects. So Sonia is mentioning, this is to do with the heat again, I think. So radiotherapy finished 7 days ago, had 5 days on both sides as she had a bilateral cancer. She's going to Italy in 10 days. And as you mentioned, the peak of the potential skin reaction, any advice that she found cover factor 50. But as you mentioned earlier, not on the area. Any other?
Yeah, firstly, glad you finished your treatment and jealous that you're going to Italy.
Yes.
Sounds great, good food, etc. So just a good point, which I probably didn't mention while we were speaking earlier, is around the differences in the lengths of radiotherapy for breast cancer. So 5 days is from a big trial called the Fast Forward trial, which about 5 years ago was implemented. So it reduced the overall 15 appointments down to 5, depending on the risk factors and the grading and the staging of the tumour. So when it's slightly less with its 5 days, we actually have found that the skin reactions are a lot less than they were for the longer 15 ones. So if you're having a 15 appointment or 20 appointments, that might just be because of the type of staging and grading. So it doesn't mean you're having anything different. They're both as good as each other, but it's the requirement for you, and we're very personalised in radiotherapy. I think if you finished 7 days ago and you're going in another 10 days, I think you should be okay in the sun. But as I said, just try and keep that area as covered as best possible. If you notice that any of the area becomes more kind of rougher or more like a wound, then that's when don't put any sun cream on, try and keep out of the sun, keep it cool. Don't put any ice on the area, even though it's really hot and you would think ice would help. Actually, ice, because it kind of cools the skin down so much, it stops that healing process. And actually, it's better to have a cool pad or like a wet flannel over the area and then a fan or something like that. So that's what I would say would be the best. But yeah, factor 15 above, keep cool, drink loads of water, be sensible. If you're having alcohol and things like that, make sure you drink even more water than before. But yeah, don't let it stop your holiday. I think it's important to be able to get away and have a clean break from finishing the treatment, but just be a bit mindful of the sun.
And what about kind of swimming in the sea or in swimming pools? Because that's a question that we often get as well.
Yeah, swimming's completely fine. So contrary to, I think, lots of evidence and stuff in the past. So the Society of Radiographers did some really good work, and they looked at all the randomized controlled trials and lots of different evidence, and they found that, swimming is completely fine as long as the skin isn't broken down. So obviously some indoor pools or outdoor pools, if they have chlorine, maybe try and avoid going first thing in the morning if you can, because that's normally when they put tons of chlorine in for the rest of the day. If you find that when you're swimming the area, when you get out and it looks a bit irritated, just pat dry and then just use almost like a cold shower to try and make sure all the chlorine is out. If the skin has broken down and it is a bit more of a wound, then we would say don't go in a chlorinated pool. And obviously, I think going in the sea with salt water would be really painful anyway, but it might help with some of that kind of cleaning it out, but just be a bit mindful. Swimming is completely fine. We want you to exercise and actually really help with your arm and shoulder mobility after surgery, radiotherapy, because you need to keep doing those exercises forever. I can't stress that enough. And I think swimming is just a brilliant way to be able to do it because it's non-weight bearing, you're out and things like that.
Absolutely, yeah, because I used to, when I first started working in breast care, the advice was to avoid chlorine in swimming after treatment. But yeah, definitely the advice has changed, which is a good thing because, like you say, exercise is always a good thing, and anything that stops people from avoiding exercise is always a good thing. So then we have another question here from Samantha that says, after radiotherapy, it seems there's no follow-up apart from a call after 6 weeks. Feels like a long time to wait. Haven't been given any information on the follow-up. not been told about any appointments with the oncologist up until the radiotherapy care is very good, but feeling like she's been left.
This is something I'm sure, Natasha, you can echo this, that we hear this quite often, that patients will have surgery, chemo and or radiotherapy, and obviously you're seeing us every day, you've got that contact, and then suddenly the term is usually you feel like you've been dropped off the edge of a cliff because there isn't anything for a while. We know that happens, and it's something called open access follow-up. So if you have any problems, you can get back in touch. But it's completely normal for this to happen. It's partly because we don't need you to come back in, but obviously for you to get that care and support, that's where, if you have a contact for the radiotherapy, the review team, sometimes a support worker, or if there's like a Maggie centre, or obviously you can call Natasha on the helpline.
Absolutely.
Things like that. That's
or your
where,
breast care nurse,
yeah, or your breast care nurse, exactly. So completely normal. I think it's important that it isn't because we don't want to see you. It's clinically, we want your body to have healed, for you to have enough time to recover post-treatment. So as I said, those 2-3, maybe sometimes up to 6 weeks post-treatment, where your body is kind of recovering, you're not having treatment, your energy levels are going up and things like that. That's why we have a bit of a longer wait. And then you'll catch up with, if it's not an oncologist, it might be the breast care nursing team again, or even the surgical team. But normally it's a really good follow-up, to be honest. And if they need you to come back in, they will. And then it will go for any follow-up scans, etc., as required.
Yeah, absolutely. As you say, quite often people get to the end of their treatment after having so many appointments close together, then they kind of suddenly feel like they're being kind of thrown out into the open. And as you say, kind of contacting your team if you need anything or you're worried, or you can call the helpline. And we also have a range of services at Breast Cancer Now that people can access. And there is a course called the Moving Forward course that is specifically designed for people that are kind of coming to that end part of their treatment, and then they're kind of feeling a little bit kind of lost. So if you wanted to find out more about that, you can have a look on our website and sign up to one of our courses. And so there is another question that's come through. I think this might be the last one at the moment, unless another one comes. But Susan is saying that she still gets pain under her arm after her radiotherapy. I'm not sure how long ago that was, but...
Yeah, completely normal. So firstly, the position we have you in, so normally your arms above your head. We know that the armpit area, the arm, anything like that around there might be what's called cording. So everyone who has breast cancer in the UK will have the just under the armpit is called the sentinel node. So that's a biopsy that's done for everyone. So they found that regardless of where the person is in their kind of pathway with breast cancer, that's if there was ever going to be a microscopic spread, that's where it would first go to. So everyone gets the node, even if there's nothing there, which is good because we're making sure we reduce that risk. But what that means is under the armpit, when they've done the surgery, that you can get what's called cording. So the muscles, the fibers, etc., kind of fuse together. And this is where doing the arm exercises. So Breast Cancer Now have a really good leaflet, which I used to always give to every single person when they finish radiotherapy, about what exercises to do. And that helps break that up. And actually some of that pain should start to dissipate afterwards. Obviously, depending on when you finish radiotherapy and things like that, sometimes you might also have other bits of swelling, and it could just be the area healing post-radiotherapy. The other thing is, depending on what type of staging and grading, lymphedema is something that is something to consider. But I'd get in touch with your breast care nurse, because lots of breast care nursing teams have sort of fluid checkers and things like that within their or they can refer you somewhere locally in the community to go and get those levels checked, just to make sure it isn't anything like lymphedema. But it is normal. The pain, sometimes people find it can continue for quite a few weeks after treatment. And again, pain doesn't necessarily mean it's a problem. It could also mean that your body's healing, and it's your body's way of telling you to slow down. I'm not saying that is the case for you, Susan, but it's something that we always say to people is, it's the 3 Ps: planning, pacing, prioritizing, just trying to look after yourself and maybe not try and do too much post-treatment.
Yeah, absolutely. And as we said quite a few times, if you're kind of struggling with any symptoms or side effects or any problems, then please do go and speak to your team and flag it up, because it may be that they want to kind of check that there's nothing else going on. But continuing with exercises and if you need painkillers, then take them, because I think quite a lot of people don't like taking medications. But if you're getting pain after the treatment, then if you kind of things should improve over time, but there's no reason to suffer and kind of just put up with the pain, especially if it's restricting your movement as well. That's another really good reason that you should go and speak to somebody, because you don't want to end up with a kind of frozen shoulder or not able to kind of move your arms and your shoulders after treatment. So it's really important to go and speak to somebody if you're having problems with pain that are stopping you from moving. Okay, so we have had another question come through, but we're coming up to 40 minutes now, so maybe we make this our kind of last question and then wrap up, even if anything else comes through. So Claire is asking, she's 7 months after radiotherapy. What are the chances of corrective surgery following radiotherapy? Mainly reference the risk because of healing. I think this might be to do with radiotherapy having an impact on the skin and kind of future surgeries to the breast area. I'm presuming that's what's meant.
Yeah, or kind of reconstruction style or things like that. I think 7 months post should be completely fine, I think, for corrective or any kind of surgery post, whatever is required. These surgeons should catch up with you. I think it varies per trust, but within the 12 months of having your surgery and radiotherapy, they do see you. So that might just be a question for them. But for healing wise, it should be completely fine, I would say.
Yeah. No, I would agree. Again, a question for the surgeons. They would be able to kind of give you all the risks and chances of any radiotherapy changes to the skin having an impact on future reconstruction or surgery. But yeah, best to speak to your surgeon about that one. Okay, so nothing else has come through, but I think we're going to try and wrap up now. So thank you, Naman, for joining us this evening and sharing your invaluable kind of knowledge and insight into this area. And thank you to any of the watchers that have joined us this evening. Glad that you could come on this kind of very hot evening and listen to us speak. Just a reminder that any questions that are unanswered or anything that comes through after we finish, we will try and reply in the next few days in the comments. Any resources that we've mentioned hopefully will be linked below, so the Rad Chat image library and also our helpline contact number. So the helpline is open from 9 o'clock tomorrow morning. If you do call out of hours, we have got a voicemail and we'll call you back. So don't worry if you call us out of hours. We're open from 9 till 4 Monday to Friday and 9 till 1 on Saturday mornings. And also a reminder about the survey, if you've got time to fill that out in the chat. The next Facebook Live is next Tuesday on the 15th of July at 7 o'clock. So two of our nurses, Sally and Jane, will be talking about waiting for treatment. And then the following Thursday to that on the 24th, there's a kind of general Q&A, which two of our nurses, Lou and Cassie, will be doing. So just a reminder of the helpline number, because I don't think I mentioned that just now, is 0808 800 6000. And thank you for joining us this evening, and good night and enjoy the rest of your evening. Bye-bye.
Thank you.